Hey guys, I want to teach you guys how to reconstitute medication that comes in what's known as a lyophilized or a freeze-dried state. This is going to be a water-based reconstitution. A lot of medication that requires refrigeration, like HCG or Trimix, or a lot of the peptides that are non-oil based, require reconstitution. And what that simply means is that we're going to take bacteriostatic water, which is sterile water that has been that it's essentially had additives added to it to make sure the bacteria cannot thrive in that environment for sterility. And then we're going to take the freeze-dried powder form of a medication and we're going to reconstitute or add sufficient amounts of water into it so that it actually becomes usable, injectable medication, which typically would be refrigerated in most cases. So your prescription, regardless of what it's for, is going to come with reconstitution instructions. And if you're going to receive a vial of bacteriostatic water, it's important that you'll notice you're going to mix or you're going to receive something called a mixing kit or a mixing syringe. It's typically going to be large and it's going to have a big needle. Don't panic, this is not for injection. This is for reconstituting purposes. So as with any vial, sometimes they'll have this little aluminum foil on the top. Sometimes they're simply going to have a plastic lid. Either way, you want to first remove it. In this case, I'm going to be reconstituting HCG with bacteriostatic water. Your instructions and your prescription specifically are going to tell you what volume to reconstitute, so it's important you follow it closely. What I'm doing here now is just for demonstration purposes. Don't follow the specific units or measurements that I am using. You want to make sure that you follow the instructions on your specific prescription. In this case, I have 10,000 IUs, or international units, of HCG, and I'm going to reconstitute a 1-to-1 ratio, which means I'm going to add 10 milliliters of bacteriostatic water. So 10 ml for 10,000 units is going to leave me with medication that is concentrated at 1,000 IUs per 1 ml. Often, some of our pharmacies will call for a 2-to-1 concentration, and they'll come with a 12,000 IU vial and 6 ml of back water. So every ml will have 2,000 units, which is a little different than what we mix for office use. So make sure you follow your prescription closely. Most of our Trimix guys, you're going to get a smaller vial and it's going to be reconstituted with just 5 ml of water. So again, pay close attention to the details on your prescription and the mixing instructions. You could always call the office with any questions. This video is more to explain the process of how to reconstitute. So with any medication, prior to piercing the vial, we don't want to introduce bacteria. We're going to take an alcohol swab and we're going to swab the top of the vial on the rubber stopper, and we're going to set them down and they're going to be air dried in about 10 seconds or so. Meanwhile, we're going to take our mixing syringe and apply the Luer lock with a twist, and then we're going to pull air into the vial. In this case, I'm going to use 10 ml of water, so I'm putting 10 ml of air pressure to neutralize the air in the vial. As I introduce the air into the vial, it's going to push back the water, as you could see, just from the air pressure. And I want to make sure that that needle inside remains below the water line. So as the water starts to come down, I'm just going to pull back. So being that this is a 10 ml vial, I'm going to use all of the water that's in it. Okay, and then I want to get rid of that air bubble on top. Come back down a little bit. There we go. All right, so now this is empty. And I got 10 ml of bacteriostatic water in my mixing syringe. When they ship these lyophilized vials, they're generally negatively pressured, which means that the air pressure on the outside is greater than the air pressure inside. There's more of a vacuum inside of the vial. So you'll notice as soon as I puncture, the water will start sucking in on its own without me even needing to push the plunger down, as you could see. This is equalizing the pressure inside the vial. All right, now all of the water has been reconstituted. With lyophilized peptides, they are fairly delicate. You don't want to shake them up. I always tell guys, treat this vial now that it's been reconstituted the same as you would with a soda can. Don't shake it, don't drop it, don't set it down hard. Imagine that when you open it up, it's gonna, all the soda's gonna pop out on you. So what you want to do is just treat it gently. So now, in order to get a good mix, I'm gonna put it on its side and just roll. And you'll notice that white foam, that's just from the powder mixing in with the water. That's going to fade and subside in about 2 minutes or so. So it's okay to give it a little whirl, and it's okay to roll. What you don't want to do is just shake it vigorously. And now that that's fully reconstituted and mixed, I'm going to have 10 ml of water and 10,000 IUs of HCG, which is a 1-to-1 ratio. 1 ml is 1,000 IUs. Again, the one you get at home, generally we like to do a 2-to-1 ratio. It's less volume to inject. Make sure you follow your prescription closely. Same thing again, trimix. Generally 5 ml of water into 1 vial of trimix. So when you look at your dose, it's going to be taking into account the concentration of 5 ml per vial. All right, so now I can set this down, and then it's going to turn clear in about 2 or 3 minutes. Remember, once the peptides are reconstituted, they must be refrigerated. Hope you find this useful. If you have any questions on any reconstitution methods whatsoever, please call the office. I would rather you check with your provider rather than do it incorrectly and have to destroy your medication. Have a great day.